Good evening, good afternoon, and good morning. This is the 1926th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor KULWANT SINGH. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends. The purpose of this forum is to take homeopathy to every home around the world. Let me come to today's guest. As you know, Professor KULWANT SINGH, sir, is the principal, Singh from Homeopathic Medical College, Jamshedpur, and is the ex-dean faculty of homeopathy, Vinoba Bhave University, Jharkhand, and sir is the former um, member, ex-chairman of CCH in Homeopathic Literature Committee, ex-member Education Literature Committee, CCH, New Delhi, and is one of the chairman of Homeopathic Literature Committee in CCH, and sir has presented so many for presentation in this forum, and all these 4 presentations were really exemplary, brilliant. And sir is an international faculty, has presented so many sessions in different parts of the world. And today, Dr. Sir will be talking about psoriasis, the monster. As we all know that psoriasis is one of the area where the other systems find it very difficult to manage, and they are not able to cure at all. But homeopathy has a different methodology of treatment. And let us see how Professor KULWANT SINGH sir has treated and how sir is sharing his experiences this way. Welcome, sir.
Thank you very much. Welcome to all, and special thanks to IFPH Forum. Without wasting time, can we start the presentation, sir? Dr. Dev?
Yes, sir. Everything fine. You can go ahead.
Thank you so much. Am I audible, sir?
Yes, sir. Everything audible and visible, and the PPT also visible.
Thank you, sir. Thank you so much. So today's topic is psoriasis. Not much about to show. Everybody knows about psoriasis, but nowadays the medical science has given a new name to this disease, and this is known as the monster. The name indicates that how serious a disease can be. So let us start that how and why this disease is known as a monster. As you can see, a monster, and we will try to describe the different reasons. So this is an autoimmune horror. It means we can understand that it is a horrible disease, which is autoimmune in nature. And after suffering from this disease, what does a man do? A man becomes so crippled with the itching only. We will be showing you the different type of psoriatic patients and the slides, but we'll try to understand first that why this is known as the monster. Very, very serious problems. The patient's life becomes just like a hell. Visibly unpredictable assault. As it is an autoimmune disorder, we cannot predict that who will suffer, when he will suffer, how he will suffer, and up to what extent it will suffer. But this suffering is very serious, chronic, relentless seizure. It indicates that this disease, normally, unlike temporary ailments, psoriasis establishes a long-term residency in the body, a chronic invader. This is a chronic invader that wages a lifelong war against the body, which periods of remission offering only brief respite from its presence. Normally, what happens, as it is an autoimmune disorder, sometimes it becomes less, sometimes it becomes more, and there is no predictability. He cannot say what are the things which will aggravate or which will ameliorate unless and until they are very clearly defined, which normally is not. So there is a chronic relentless seize of the body, and this causes mental and emotional anguish. This is one of the most important aspects of a serious chronic psoriatic patient, because the patient becomes just like, sorry, I'm really sorry. So the patient becomes mentally, socially in siege, means the self-esteem is devoid, there is social isolation, the visible lesions often trigger fear and misunderstanding in others, leading to avoidance and judgment. As mostly they are extensor surfaces are more commonly affected, so when the effect is on the extensor surface, it is visible. So the patient's social life is destroyed. And that is the reason it is known as monster. So your self-esteem is devoured, the pain, there is a complication known as psoriatic arthritis. Normally, psoriasis is a skin disease, but in the longer run, due to autoimmune disorder, this affects the joints. And when the psoriasis is affecting the joints, the patient's life becomes hell. It becomes immobile, and there is emotional and mental anguish. The persistent physical discomfort, social rejection, and impact on quality of life can lead to depression, anxiety, and a constant state of emotional turmoil. That is where our medicines can act. A complete emotionally disturbed, the life is disrupted, and you can just morph into terrifying forms. As I told you, it is an autoimmune disorder, problem of the immune system. So it becomes on the body in different forms, different places, different intensity, different severity, and overall the patient of life is disturbed. This is in short the history of this disease, and you can see the history in the ancient times. The Hippocrates described there are flaky skin conditions, possibly psoriasis, but normally these lesions were known as part of leprosy, and that is why the patient was rejected from the society. Psoriasis was often mistaken for leprosy, but gradually one treatment was very successful in those times, and that was coal tar treatment. The coal made from the trees, pine trees. So pine tar coal was used or applied in these lesions and was found very successful in that condition. And Dr. Galen, who was a great anatomist, he gave this name, psoriasis, to the disease and differentiated this with leprosy. So this coal tar treatment, the tar of the pine tree was proved to be anti-proliferative, anti-inflammatory, antipruritic, antiseptic. And all these conditions were linked with a case of psoriasis. This is from the history and atlas from 1860 to 1884, and this kind of a problem were found to be present in those conditions and those times also. You can see this kind of conditions were present, the severest kind of psoriatic lesions, and this is found from the atlas of a museum. This was the Sydenham Society Atlas was from the museum. This is a just illustration on the walls where the young boys are itching. There is severe itching in the extremities like the psoriasis symptoms. And this is the sculpture made of a psoriatic patient during those times. So there is a global prevalence of 2-3% of the population. You can imagine if a person is suffering 2-3% of population, how many crore patients are present of this condition. And higher prevalence is Caucasians. Age of onset is almost all age groups, but normally it starts after the age of 15 to 30. And onset peak is 50 to 60 years. This is, in short, the demography. So let us try to understand the root cause. Because psoriasis we treat a very common disease, not very difficult to diagnose a case of psoriasis when we see a patient in practice life. But normally we must know that how and when this disease can happen and how the progress of the disease happens. So people inherit certain genes such as HLA-CW6. This is the gene. If this gene is present in a patient, he will be prone to suffer from psoriasis. This is the root platform that it is a genetic problem and HLA-CW6 gene is responsible for this. The most important, the spark. What are the trigger factors? So the trigger factors are regular infections, skin trauma, stress, smoking, alcohol, drugs. Out of this, the skin trauma is the most common. You get any injury on the skin, it is not treated properly, and gradually you will see that in the long run, there are formation of the scales on that injured part. So that part, after a skin injury, in a long run, it can form symptoms of psoriasis. And along with this, if there is an immune activation, due to this genetic factor, there are immune activation. So there is activation of the immune cells in the system, and these triggers activate the immune system, even though there is no real infection to fight. So very strong point, very important point. There is no proper, real, apparent infection in the system or in the skin. But gradually, due to the strong immune activation, this disease can happen. So see, in short, what happens? Our skin is replaced gradually on a day-to-day basis. This is the fact of life, that our whole skin gets replaced. Normally, this replacement takes place 28 to 30 days. We don't know about this. We don't see about this. But normally in 28 to 30 days, in 1 month, gradually what happens? That all the skin cells are replaced. But in case of psoriasis, what happens? Due to immune activation, due to overactivation of the cell division, cell proliferation, this problem comes in 3 to 6 days. So this proliferation, this shedding of skin, when comes within 3 to 6 days, the body is not able to fight with it, to manage with it, and that extra cells which are proliferating, they become accumulated above the skin, and that condition is known as psoriasis. So there is plaque formation, there are layer formations, because the skin, the body is not able to stop that speedy proliferation, and that speedy proliferation causes psoriasis. So these are the most important factors, that this is an autoimmune disease. We must know, repeatedly, everywhere you will be asked why it is happening, how it is happening, what are the conditions. So this is an autoimmune disorder. There is no explanation after that. And this is activated from the genetic factors. So, and normally after these, if you have this gene or if you have the tendency for the formation of psoriasis, the dendritic cells of the skin, they are activated. immune cells initiate antigen presentation. So these dendritic cells are activated, and dendritic cells in the skin, they in the course activate the T cells. We have read about the T cells. They are autoimmune cells which are releasing cytokines, poisonous materials, antibody materials, and these cytokine release, they are responsible for hyperactivity of keratinocyte, which I was explaining in the earlier slide, that there is a hyperactivity of keratinocyte, and so there is gradually more speedy exfoliation of the skin, and gradually what happens, the body is not able to cope with this, and there are plaque formation. So immature cells form plaques, and there is a plaque above the skin, and you will be realizing that the skin is itching. After itching, there is a plaque formation. Plaque are coming out in layers, and that condition is known as psoriasis. Normally, they are symmetrical. In general, they are symmetrical. That is the most important difference between the other skin lesions in case of psoriasis. So there is genetic predisposition, which I told you. Genes like HLA-CW6 are strongly linked to psoriasis. Second, I already told you the skin trauma. There is skin injury. The physical trauma on the skin can trigger psoriatic lesions. Emotional stress, very important factor. The stress aggravates psoriasis significantly. It may not cause psoriasis, but it can aggravate due to the emotional stress. Lifestyle factors, especially smoking and alcohol. These two are the things which can aggravate. It has been observed and proved clinically. There is metabolic condition, obesity and metabolic syndrome. It has been found that obesity and metabolic syndrome is a disease combination of symptoms which are known as metabolic syndrome. So these two conditions are always increased psoriasis. And one hormonal changes are also sometimes responsible for psoriasis. So this is the introduction of psoriasis in short, but we will try to understand now the different types of psoriasis. What are the different types? Psoriasis can be of different types, and that is the main context of this presentation, that we must understand, we must diagnose the type of psoriasis. And nowadays, patients all want to know. You will say, okay, you are suffering from psoriasis, but the patient through internet and different sources are already aware that what kind of psoriasis they are suffering from and what are the different stages and different type of treatment. In between them, you will have to cure them. So the first type, as you can see in this video, that is known as plaque psoriasis. Psoriasis types, number one is plaque. You can see the plaques. These plaques are coming, the layer is coming out from the skin very easily. It is not very painful. So easily it is been removed, scraping. They are scraping the scales. This kind of known as, mostly I told you that they are in the extensor surfaces. They are symmetrical, always occurs in both sides. If there is this elbow, it will happen this elbow also. So it normally is both sides, silvery scales, red patches, most frequent. Most frequent type of psoriasis is plaque psoriasis. And normally we see and we diagnose that this is a plaque psoriasis. You can see the plaques. Plaque psoriasis. Just see, you can watch another video where there are different kind of plaques. You can see severe plaques. The common type, 80 to 90% of plaque psoriasis are of plaque psoriasis. Very severe problem. That is why I insisted that this kind of a problem, if a patient is suffering from this kind of a problem, the psychology disturbed. Emotionally, psychologically, socially, he is so disturbed, he can't go to meet people, he can't go outside, and that impact shows on his system, on his body, on his mind, and his social life is greatly disturbed. A common location is elbows, knees, scalp, and lower back. Symptoms are lesions are itchy, painful, and may crack. There are cracking. The picture is clearly visible that we can understand. And trigger factors are stress, infections, cold weather, skin injury, and smoking. Stress is a factor which normally does not cause psoriasis, but it aggravates into it. Cold weather, due to cold weather, the skin becomes dry. So it adds on this factor, and due to the dryness, there are more cracks, more plaques, bleeding, pain, itchy. And nature is autoimmune in nature. This disease is always having an autoimmune nature. Like in our last lecture, we had discussed the rheumatoid arthritis also. That also was an autoimmune disease. There are so many diseases which are autoimmune, but psoriasis is very common in practice life. So it is very important for us to understand what psoriasis is. This is the second type of psoriasis, which is known as scalp psoriasis. This is the severest form when it has developed in the scalp and the hairs have stuck together. The complete hairs are stuck together. It becomes very difficult to treat these cases because the cleaning of the hair becomes very difficult. Treatment challenges: difficulty applying local medication due to hair, intense itching and discomfort, scalp scales and patches. And it is not contagious, it is an autoimmune condition. I'm repeating, autoimmune condition is there, but if there more stress on the scalp, so many cases you will get when there is a scalp psoriasis. It may not be of this severity, but scalp psoriasis is very common, next to plaque psoriasis. After plaque psoriasis, the cases which come to you will be of scalp psoriasis. The next type is goutte psoriasis. Goutte means drops. You can see the eruptions are in drops. So these kind of eruptions, if present in case of psoriasis, are known as, it is psoriasis, but the type will be goutte psoriasis. The appearance, there are small red teardrop shaped spots characterize this condition. You can see strep throat infections are frequent trigger. This is very important. Normally, it happens after a strep throat staphylococcal infection. And this kind of a strep throat and goutte in drops, in particular drops they appear. It may disappear on its own or become chronic. Sometimes what happens, if it is due to the streptococcal infection, so as the infection comes down, sometimes there are chances that this goutte psoriasis will go automatically. But mostly they remain there and they trouble the patient. This kind of rashes, if found in psoriasis, the small drop kind of thing, they are known as goutte psoriasis. The next type is inverse psoriasis. The inverse psoriasis is a condition which normally occurs in fold of joints. Location: it occurs in skin folds like armpits and groin. So I'm stressing this because there are very common fungal infections which are present in these two areas. Very common, which is not psoriasis. But fungal infections are very common in these two, groin area and armpits, where there is more sweating. The appearance of psoriasis will be smooth, red, inflamed patches. You can see this is a joint, and just surrounding the, you can see this joint, folds of joints, this kind of rashes will be there. And very common, there will be aggravation by friction and sweating. Appearance will be smooth, red, inflamed patches without the scales. The plaque psoriasis is having definite scales. So we may be confused this condition with severe fungal infection. And the confirmation will be done on the basis of symptoms, on the basis of looks, and if necessary, going for a biopsy, skin biopsy. Skin biopsy, if it is not being cured very easily, we can go for a skin biopsy, and after the skin biopsy, we can confirm that whether it is an inverse psoriasis, whether it is an fungal infection. And little more dangerous type of psoriasis is pustular psoriasis. This is really serious problem because there is formation of pus. So pustular psoriasis, which causes white, non-infectious pus-filled blisters. The pus consists of white blood cells. There are pustules, pus, you can see the pustules. So there is pus-filled bumps specific to the condition. Redness of the skin, location can be specified to some area. It can be widespread. The general forms can be very severe and requires immediate attention. Otherwise, due to the pus, the infection may spread inside below the skin, and there may be severe complications. So whenever you think that this is a case of pustular psoriasis, psoriatic patches, eruptions, and having pus, we will be discussing this in detail when we will discuss the treatment part of psoriasis. So all kinds of psoriasis, what are the best medicines for different types of psoriasis? But this is one type which is known as pustular psoriasis. Normally, most common type is plaque psoriasis. The second common type is scalp psoriasis. And the third common type is nail psoriasis. You can see. Subungual means under the skin. So there is hyperkeratosis, which I am repeating this. There is hyperactivity of the skin cells. The growth is not stunted. The growth cannot be controlled. Uncontrolled growth of the skin cells. And if it is on the skin, there are plaque formations. If it is under the nail, then there will be this kind of a condition. Thickening of the skin under nail leading to deformation. Crumbly or deformed nails brittle, ridged or distorted, because they are not able to control the extra growth of the skin under the nail. Sometimes nails are broken. Sometimes the growth becomes so large that it comes outside the nail. You will see the patient will come that there is a psoriatic nail and there are extra growth outside the nail. Pitting and discoloration. Separation of nail from nail bed causes lifting. That is what I was discussing. That separation, this nail bed will be separated from the nail and the skin. It will come up, and from the below the nail, there will be extra growth of the skin, which will be very, very clearly visible. So this kind, mainly the psoriatic type, plaque psoriasis, 80 to 90% of the patients. Nail psoriasis, very common. Sometimes the plaque psoriasis is combined with nail psoriasis. And one type is scalp psoriasis. So scalp psoriasis is sometimes it looks very similar to seborrheic dermatitis, that is dandruff. Sometimes serious cases of dandruff, they look almost like a psoriatic patient. But seborrheic dermatitis or dandruff, they are easily removed. Psoriatic patches are not easily removed. They have severe plaques, layers. In seborrheic dermatitis, there are some deposits, but not severe layers. So these are small differences which you will have to understand that when this is a case of seborrheic dermatitis, when it is a case of psoriatic dermatitis. Psoriatic patches on the scalp are very, very troublesome. Very troublesome. They make your life hell. And the most dangerous type of psoriasis is, it is sometimes very difficult, very, very difficult to save the life. This, you can see this erythrodermic psoriasis. It almost spreads all around the body. And it becomes extremely difficult to control this kind of erythrodermic psoriasis. If you can see, my honest advice to all of you, if you see a case of erythrodermic psoriasis, don't try to treat it immediately. Take help of some allopathic physician, because they will have to prescribe antibiotics. They have to prescribe. They'll have to give you some corticosteroids. So corticosteroids with antibiotics may control the condition, may save the life of the patient. And that is, my friends, very important when you treat a case of erythrodermic psoriasis. I have been reading a few cases, the claim of some doctors, which they claim that they have cured or they have treated a case of erythrodermic psoriasis very successfully. But normally in my practice life, the cases are very less. Erythrodermic dermatitis is not very common. But if you get a case, be serious, be thoughtful, and don't take these kind of very, because there is severe pyogenic infection which may take place. If there is severe pyogenic infection, the patient may die. It will be very difficult to save a patient's life. Yes, sometimes yes, if the medicine is there, if the symptoms agree, if the constitution totality of symptoms agree, you can try. We can try this medicine. And there have been some cases reported that erythrodermic psoriasis has been cured by by homeopathic medicines also. But please be careful while treating this case. Now, one of the most common complications of psoriasis is known as psoriatic arthritis. I gave you a hint in the beginning of the lecture that due to psoriasis, due to autoimmune disorder, sometimes psoriatic arthritis is an autoimmune inflammatory disease where the immune system mistakenly attacks healthy joints and skin cells. So if there is autoimmune disorder and by mistake they take the healthy cells, healthy joints into consideration, so they may produce inflammation of the joint, they may produce degeneration of the joints, and severe arthritic pain may accompany a case of psoriasis. And this condition is common. A patient suffering from psoriasis, if not treated properly, is very commonly suffers with psoriatic arthritis. So this combination is very common in practice life. You will see genetic and environmental factors trigger this response, leading to an overproduction of certain immune cells. These cells then migrate to the joints and skin. Both, they migrate to the skin, they migrate to the joints. They migrate to the skin causing psoriasis, they migrate to the joints causing psoriatic arthritis. And the symptoms are swelling, pain, scaly skin patches. So sometimes there is a slight confusion whether the patient is having severe arthritis or severe psoriasis, but you will have to be very careful in case of diagnosing a case of psoriatic arthritis, which is a part along with psoriasis. If the patient is suffering from psoriasis and due to psoriasis in the long run, the joints are affected due to autoimmune disorder, autoimmune reaction, then this condition is psoriatic arthritis. There is a joint damage leading to deformity and motion loss. There are spinal issues. There are cardiovascular issues may come. This eye problem is very common. I have seen hundreds of cases of psoriasis which are having some problem with the eyes. The condition is uveitis, inflammation of the eye muscles and eyes, and there is severe redness, pain, and most of the patients go to the eye specialist, try to treat them on the basis of eye symptoms, but basically it is due to the psoriasis. If their psoriasis is relieved, the eye symptoms can be relieved. And nowadays, I have seen so many eye specialists who see these cases and they refer their patients to either homeopathy or allopathy, and they are asked to take medicine for psoriasis. Because if they take medicine for psoriasis, this condition will be healed. And there is enthesitis. This enthesitis is the inflammation of the tendons and ligament on the particular site. If this can be associated with the joints, with the psoriatic arthritis, this condition is known as enthesitis. And in the medicinal part, in the treatment part, we will discuss all these things. What are the complications? What are the medicines? What are the constitutional symptoms? We'll discuss into that. So, but psoriasis basically is a problem which affects almost every part of the society, every age of the society, and it's a very, very troublesome problem. It is a real troublesome problem for a patient to get out of it. And gradually, as the disease progresses, there are severe complications. And these are some of the complications which I discussed with you. The first of all, we must understand that how we will recognize the type. The type is very important. If you write in your prescription, case of Gupte psoriasis, everybody is impressed. You think that a homeopathic doctor is diagnosing it properly. Normally, I have seen so many big prescriptions of a big doctor. They simply write itching lesions, flakes, scales present, khatam. That is all. No proper diagnosis is written. You must try to understand, and it is my folded request to all of you, when you see a case, try to write the diagnosis properly. You treat as per homeopathy. The treatment part should be on the basis of pure homeopathic, totality of symptoms. But for as we are living in society, so we must know, we must write, we must be bold enough to understand the disease and prescribe properly. These are a few very common complications which cannot avoid in case of complications of psoriasis. Psoriasis, so there is psoriasis, but we must understand that what can be the complications, the system, the effect on overall all systems. So psoriasis disturbs your life. I told the name is psoriasis, the monster. It is a monster in your body. It is not only a skin lesion in your body. So the most common complication which I have discussed just now is psoriatic arthritis. When the autoimmune symptoms, they develop the immune system, autoimmune goes in a wrong direction, and that wrong direction causes inflammation of the joint and pain in the joint. That is psoriatic arthritis. Sometimes these autoimmune disorders, the autoimmune imbalance, they can affect the vascular endothelium. So if the vascular endothelium of the blood vessels are affected, there may be impact on cardiovascular disease. The cause is increased atherosclerosis risk due to high CRP. So stress, metabolic dysfunction, and persistent inflammation damages vascular endothelium, causing cardiovascular disease. There is obesity, and there is, I told earlier also, there is metabolic syndrome. Metabolic syndrome is a combination of so many diseases which can affect your body, and that condition with the cytokine, there are decrease of cytokines, increase of cytokines in the system, especially TNF alpha and IL-6. There are two cytokines, TNF alpha and IL-6. They cause insulin resistance. And due to insulin resistance, there is reason that you may suffer from diabetes. Next is type 2 diabetes mellitus. This is due to insulin resistance. And next, the most common part which we have already discussed, that there is depression and anxiety. So this depression and anxiety are the after effects of psoriasis. A long suffering in case of psoriasis may cause depression and anxiety due to the lesions happening in the body. The patient is not getting cured, the patient is not feeling better, and in the long run, the patient becomes depressed. And there is severe anxiety. And due to the obesity and metabolic syndrome, what happens? It narrows the upper airways. Due to the obesity, sometimes it narrows the upper airways, and due to the narrowing of the upper airways, there is sleep apnea. See, there is sleep apnea. It is due to metabolic syndrome, but the basic cause is psoriasis. Due to psoriasis, the patient is having metabolic syndrome. Due to metabolic syndrome, it is having obesity. Due to obesity, there is pressure on the upper tract. And while the patient sleeps, he just chokes up and gets up. So that choking and getting up in sleep is known as sleep apnea. The same autoimmune disorder may affect your kidney. So that condition is known as CKD or chronic kidney disease or renal disease. And this is due to immune-mediated injury, and hypertension. These are the two things which can cause this kind of thing. And the next is NAFLD. NAFLD is non-alcoholic fatty liver disease. This non-alcoholic fatty liver disease is due to metabolic disturbances linked with psoriasis. They affect the liver metabolism. And this effect on the liver metabolism is known as NAFLD. The patient suffers from fatty liver, and there is COPD. COPD, everybody knows that if the effect is on the lungs, there will be chronic obstructive pulmonary disorder. That is bronchial asthma, severe bronchitis, and I was discussing uveitis. Yes, uveitis is when the autoimmune effect goes to the eyes. So there is pain, there is redness, and overall there is blurred vision. So psoriasis, patients suffering from blurred vision, you will have to understand this is the complication of the psoriasis. Now, how will we diagnose a case of psoriasis? So let us see. One is primarily clinically diagnosed. It is diagnosed by 80 to 90% of these patients are of plaque psoriasis. And plaque psoriasis is easy to diagnose because there are plaques, they are symmetrical on the both sides. They are having redness, they are having pain, and the plaques are silvery in look. So these are clinical diagnosis. By watching, we can understand that what kind of a problem this is. And next is Auspich sign. The Auspich sign is a clinical feature seen in psoriasis when the silvery scales are gently scraped off and there is a tiny small red point behind. If you remove a scale, there is very tiny spot. This kind of a sign also confirms a case of psoriasis, and the sign is known as Auspich sign. And if there is erythematous plaque, it is very easy by naked eye. That is erythematous plaques. And next is Koebner phenomena. Koebner phenomena is a condition when there is a skin injury. There is history of skin injury. When it heals, there are plaques coming on the part where the injury was there. If this condition is present, this is known as Koebner's phenomena. In Koebner's phenomena, there must be history of injury. If there is no history of injury, this condition will not be known as Koebner's. Next is one very accepted PASI score is there in medical science, which is psoriasis area and severity index. There is a specific formula to which the all symptoms are noted and under what area, which type of area, what type of area, how much of area is impacted on the body, and that score is used for diagnosing a case of psoriasis perfectly. And when you depend on this formula, this is known as PASI score. Psoriasis area and severity index. There are a few points. I'm not going to details of those points. Family history is a diagnostic factor. Skin biopsy is very important. I told you in the first part also that if there is any confusion, go for a skin biopsy. Whether there is a fungal thing, whether there is other thing, whether it is psoriatic thing. In case of psoriasis, you will see that skin biopsy will show you acanthosis. Acanthosis is thickening of the skin. The thickening of the skin layer, formation of layer, and red ridges and parakeratosis. More keratin deposition. This will confirm the diagnosis of psoriasis. In case of fungus, you will get the fungal infection positive. But in case of psoriasis, there will be acanthosis. Keratosis, skin, the layer becomes very thick. We have been reading this acanthosis nigricans in case of PCOD. There are thickening of the skin of the neck. The thickening the skin tissues become very thick. They become blackish in case of PCOD. So that acanthosis is also found in case of biopsy, and very important part, that symmetrical distribution. You can see in both hands, it is here, it is here. So both hands are affected. So this is a symmetrical distribution. These are a few very important points for diagnosing a case of psoriasis. Next will come the differential diagnosis. How will we differentiate and what are the conditions by which we will differentiate? Let us see. Seborrheic dermatitis, which I told you in the early lecture part of the lecture, that is fungal seborrheic dermatitis. They are greasier scales, often on the scalp, face, and chest, less well demarcated than psoriasis. Psoriasis is very specific demarcated. There are more flakes in case of psoriasis, less flakes in seborrheic dermatitis. You can see this kind of patches will be in seborrheic dermatitis. Next is atopic dermatitis. In plain language, this is eczema. So this kind of rashes, eczematous eruption, more intensely itchy, less well demarcated, often on flexural surfaces. You see, these are flexural surfaces. Psoriasis is on extensor surface. Lichen planus. So lichen planus is very easy to diagnose. You can see characterized by purple polygonal pruritic papules, often on wrist, ankle, and oral mucosa, but they may not be both sides. They may not be symmetrical. They may be one-sided, and there are no large flakes. There are no large flakes. They are small patches, purple in color. These are known as lichen planus. And tinea corpus is very easy to diagnose because the name itself indicates that this is ringworm. In case of ringworm, that is fungal infection with lesions confirmed by microscope. Next, pityriasis rosea. This is very similar with the ringworm. This is not like a psoriatic patch. It looks like a ringworm, so that the only difference will be there is a herald patch. In case of pityriasis, there will be a ringworm kind of appearance, but there is a herald patch. The central patch is very great keynote for diagnosing a case of pityriasis. Next is drug eruption. This is a reaction of a drugs. It spreads all over the body, unlike psoriasis. Various medications can induce psoriatic-like or other inflammatory rashes. So there will be history of taking drugs. Next is lupus erythematosus, very rare disease, but very important, very dangerous problem, but it is easily diagnosable because this patch can cause scaly erythematous plaque, especially on sun-exposed area. So just besides the nose, on the cheeks, there are rashes. These are indicative of lupus erythematosus. There are different tests also, and this is a serious problem. This is a serious problem. Next is mycosis fungoides. The rash is above the skin, they comes out of the skin, can mimic chronic eczema or psoriasis, requires skin biopsy. So this is cutaneous T cells lymphoma. So unless until you go for biopsy, you will not be able to differentiate from the psoriasis. And nowadays, a very specific formula is there, and established formula is there, but when there is imbalance between your gut and the skin, you are prone to suffer from psoriasis. And see, these are when the normal balance is maintained between the healthy gut flora and healthy skin. But gradually, if there is imbalance, this is healthy skin, this is the part of a healthy skin, this is blood flow. But if this is disturbed, there is severe flake. You can see the flake formation on the skin, and this is psoriasis. And this clinically proved that this may be due to gut skin axis. This is the gut health. If your gut is properly healthy, the gut is healthy, and there is SCFAs are healthy. What is SCFA? The short chain fatty acids. The SCFAs are known as short chain fatty acid. If they are normally functioning, there will be no problem on the skin. But if this axis is disturbed, what is the cause of this disturbance? The cause of this disturbance is T cells, inflammatory cytokines, autoimmune disorders, immune disturbances. And due to these immune disturbances, there is extra growth of the epidermis, and this is known as psoriasis. So always try to remember that this is an established fact nowadays, that if there is your gut health is normal, the flora, the bacteria are normal in the gut, you will be not suffering from psoriasis normally. But if this axis is disturbed, there will be formation of psoriasis. So there is gut dysbiosis. This condition, the disturbance in the gut, is known as gut dysbiosis. There is imbalance, but bacteria leading to inflammation, activation of T cells, reduced production of anti-SCFAs, short-chain fatty acids are reduced, disruption of pathway affecting the skin health, and there is skin inflammation and psoriatic inflammation. I tried to explain this in very short manner, this very big chapter, but this part is over. In the next lecture, we will be discussing the treatment part of psoriasis. Thank you so much. Thank you, sir.
Thank you, Kulwant Singh sir. It's really a very good session, and you really covered all part of this psoriasis, and we need some of the case presentations also that sir will be showing to us. In the
We are coming to that in the next Tuesday, when
yes,
we discuss the treatment, and I'll show you a few very good cases where we have treated the psoriatic patient.
yes, sir. Those who want to participate in the discussion may kindly open your, or
if you have any question, if we have some time.
Yes, sir. Those who want to have questions, you can ask the questions now. Just 5 minutes remaining. Yes, Ramirez, sir, you can speak.
Thank you, Dr. Dhanesh ji. एंड हमारे डॉक्टर वेणुगोपाल रेडार सर नमस्कार, एवरीवन नमस्कार, कांग्रेचुलेशन डॉक्टर कुलवंत सिंह सर, very nice presentation. All presentation is a very nice and dynamic, excellent, and rare disease or psoriasis. Deeply describe the psoriasis, cause and effect psoriasis. Very good describe. And last this you describe gut health. Gut health is a
Sir,
healthy
sir,
psoriasis.
there is a
Hello,
question.
hello,
Uh,
sir.
so many people are asking about the homeopathic treatment. I have repeatedly told that in the next lecture on next Tuesday, we are discussing the second part of psoriasis, in which we will discuss the mathematic part, treatment part, and we will also discuss a few cases.
Yes, because it is only a 1 hour presentation.
Thank you, sir. Thank you. Thank you. Again, presentation, discuss the medicine. Thank you, sir. Very thank.
Sir, what is the success rate according to you in the cure and or just managing the case?
If the case is not very chronic, then the success rate can be somewhere 60 to 70%. But if the case is very chronic, then the success rate is comes down, but long time relief is possible. Because it reappears, it goes down, it comes down, the lesions are cleared, but after 6 months or 1 year, it has been observed in my practice life that the lesions may come up and you'll have to treat it again. But
Okay, sir. Okay, sir. Patient is patient, and doctor is a patient. Then treat the psoriasis.
Okay, sir. Then, sir, most of the psoriasis patients used to come to us after suppressing with some steroids or some other ointments. And what's your first approach to that?
we'll come to that in the next part.
Okay, sir. Okay, sir.
Coming to that.
Okay.
But normally, if that, as per there are two basic ideas. Number one, if there is regular history of taking allopathic medicines, we must antidote them. And second is, based on the totality of symptoms, we should start the treatment. There are two types of treatment. One is to give some relief to the patient if the patient is in a very acute condition. But along with the relief in acute conditions, we must prescribe scientifically on the basis of totality and miasm. Then only the patient will be ordered.
Okay, sir. And now I am inviting Dr. Bob Lim to say what of thanks to the session. Dr. Bob, please unmute yourself and you can speak. We will be uploading the videos of the presentation tomorrow itself so that those who missed the session can watch it. You can subscribe without paying any money. You can share it with anyone. That's the methodology of IFPH. And next Tuesday, we will have the second part. Already we have planned such a session. Sir has requested for 2 sessions for this person. Anyway, on behalf of International Forum for Promoting Homeopathy, as well as on my behalf, I'm thanking you for one of the best presentation here in this evening, sir. Thank you, sir.
Thank you.
Tomorrow we will have a session from Dr. Rohit, and Dr. will be talking about some breast cancer management with homeopathy. Over to Dr. P. Shaila to moderate the Malayalam session.